Hello, good afternoon. I am Dr. Imtiyaz Pathan, consultant physician from Itzelkrinji, and our today's topic is pedal edema and CKD, the causes, the symptoms, and the treatment. Welcome to the today's session on pedal edema and chronic kidney disease, or CKD. Today we'll explore what pedal edema is, its causes, how it relates to CKD, and the best ways to manage it. First, let's see what pedal edema is. Pedal edema is a condition where extra fluid accumulates in the lower legs and the feet, causing them to swell. This swelling can happen for several reasons, such as heart problems, liver issues, thyroid issues, kidney issues, or blood clots. Our body fluids are divided into two main areas, inside our cells or outside them. The outside area includes the space around the cells and inside our blood vessels. Edema or swelling occurs when there is a problem with how fluids are distributed between these areas. This problem can happen if too much pressure builds up in the blood vessels, often due to heart issues or excess fluid. It can also occur if there aren't enough proteins in the blood, like albumin, which can keep the fluid in the vessels. Additionally, the lymphatic system normally helps more extra fluid and proteins back into the blood. But if this system isn't working properly, fluid can build up and it can cause swelling. The kidney plays a crucial role in regulating the body's fluid balance. The kidneys help remove the waste and regulate fluid. When they are not functioning properly, fluid can accumulate, leading to edema, as seen in CKD or acute kidney injury or nephrotic syndrome. Edema is one of the major symptoms of CKD. Let's explore how clinicians approach the diagnosis of edema. First, a detailed history helps identify risk factors and underlying conditions like heart failure, kidney disease, or thyroid disorders. Edema can be generalized or localized. The generalized edema, this type affects the entire body or large areas and is often linked to conditions such as heart failure or kidney failure. Localized edema is a this type causes swelling in just one area of the body. It's often due to inflammation or a blocked lymph node flow or issues with blood flow in the veins. During a physical exam, clinicians look for pitting edema, that is indentation after pressure, indicating heart failure or nephrotic syndrome. Non-pitting edema suggests a lymphatic obstruction or hypothyroidism. In the case of renal disease, the following lab tests and imaging are helpful. CBC, renal function tests, including the serum creatinine or urine analysis, urine microalbuminuria, and urine albumin to creatinine ratio, as well as an ultrasound of the abdomen and pelvis. A thorough history and the physical exams are the key. Identifying systemic causes and specific signs include the management plan. When it comes to managing edema, the approach depends on whether the cause is local or systemic. For local causes, non-pharmacological treatments are essential, alongside addressing the underlying issue. For systemic causes, the combination of general measures and targeted treatments are needed. For local edema, non-pharmacological measures include the limb elevation. Regularly elevating the affected limb helps reduce the swelling. Compression therapy. Wearing a compression stocking can assist in improving blood flow or reducing edema. Physiotherapy, massage, and other physical therapies should be performed by trained professionals. Ice applications, useful or useful for severe or congested edema in case of cellulitis. In cases where systemic causes are at play, such as CKD, treatment focuses on reducing the fluid retention and addressing the underlying conditions. This involves salt restrictions. Limiting the salt intake helps prevent fluid buildup and manages volume overload. Diuretics. These medications increase urine output to help manage fluid levels. Different fluid types include the loop diuretics, for example, furosemide or torsemide, often preferred for their effectiveness and longer duration of action. Thiazide diuretics, for example, the metazolones, used adjunctively for the enhanced diuretic effect. Then the potassium-sparing diuretics, for example, spironolactone, used cautiously due to the potential risk of hyperkalemia. The choice and the dose of diuretics depends on the factors like the severity of the edema, the patient's hemodynamic status, and the kidney function. It's important to use diuretics cautiously to avoid complications like hypokalemia, hypotension, and electrolyte imbalances. Regular monitoring of fluid volume, urine output, blood pressure, weight, and periodic tests are essentials. In chronic kidney disease, the managing edema often requires salt and fluid restrictions essential to the control fluid retention. High dose diuretics, low power diuretics like furosemide are usually effective, but thiazide diuretics can be added if necessary. Managing edema involves a tailored approach. For local causes, non-pharmacological methods are the key, and the systemic causes require dietary adjustments, diuretics, and close monitoring.